Let's see an example of the 1-minute preceptor in action.
I just saw Miss Martinez. She's a 52-year-old female, non-smoker with a cough for a week. It's getting worse and it's productive of green phlegm.
The instinct here is to interrupt and say, did you ask about a fever? Is there a history of asthma? Or, did you ask about a flu shot this year? Try to resist the urge to interrupt and let this resident continue.
During the examination, I noted a low-grade fever and mild tachycardia. Overall, the patient appears unwell. My primary concern arises from difficulty hearing breathing sounds on the right lung.
Good. Okay. Now, based on your observations and examination, what is your diagnosis?
I'm worried about pneumonia.
Good insight. What prompted you to consider pneumonia, and what other potential diagnoses are you considering?
I considered the possibility of the flu, but she did have her flu shot this year, and I didn't hear any wheezing upon examination. I also thought about COPD or asthma, but she has no smoking history and no prior asthma diagnosis. What stood out the most on the exam was decreased breath sounds and no wheezing. Generally, her overall appearance looks pretty sick to me, coupled with the presence of a fever.
One general rule about pneumonia is that there are clinical predictor rules that we can use to access how sick the patient is. Why don't we look those up together before we go in?
Great.
Unfortunately, I think you're right to be concerned about pneumonia, considering the fever, the tachycardia, and the diminished breath sounds. It's good that you asked about vaccine status, and I suppose if she were less sick than viral bronchitis, it would be more likely. But with these vitals and decreased breath sounds, I think you're right about pneumonia. Your reasoning is sound and logical. One thing you might have done differently upon examination is to look for consolidation with percussion of the lungs or the echophony test. These additional steps could have provided further insights. Additionally, noting the oxygen saturation would have been crucial, as a low O2 saturation level could also indicate the presence of pneumonia.
That is a great point. I didn't look too closely at the O2 stat. I was focused on the heart rate and temperature.
Why don't we go back into the exam room together and we can percuss her lungs and check for echophony then?
Great.